wellness visit for a child, one of our biggest concerns is, are they growing appropriately? We look at the growth charts, we make sure that they have all their immunizations, and we just make sure that everything is kind of progressing to plan.
A lot of the major orders that we put in the standard pediatric visit are for your vaccinations, which is probably the most important thing we do in pediatrics, quite frankly.
Childhood vaccines start pretty much at birth, where we recommend, hepatitis B right before they get out of the hospital. And then you have your 2-month shots, your 4-month shots, your 6-month shots. And then at a year, we get our measles, mumps, and rubella. And you get vaccines a lot in your first year of life, and then it kind of dies out.
There are guidelines from the American Academy of Pediatrics. So there's certain requirements at certain time intervals for a blood count, for a lead level. In terms of what parents should know is there are developmental milestones that kids should be reaching every year. So a 2-year-old should be putting 2 words together. A 4-year-old, their speech should be clear. A 3-year-old should copy a circle. And if the kids are not reaching those milestones, that's a concern. And every time I see a kid for a well checkup, part of my exam is going through development.
I think it's really important to have a set pediatrician for continuity. So someone who knows your child, who knows you, who knows your preferences, who knows your child's past illnesses, what you've been through, so that they can anticipate potential complications of treatments, so that they know what's been done, what hasn't been done, so you're not duplicating tests, lab draws, things that are uncomfortable for children. And again, knowing your preferences, knowing what's worked and what hasn't, knowing how to approach you, what you like. So I think the continuity is very important.
Nutrition is so important in kind of development that's one of my big concerns. The other concern is also kind of their emotional and social well-being as well. So every well visit on like an adolescent or teen, I talk to them about bullying. Now in our age, I talk about social media. We talk about screen time, and we just kind of get this holistic look.
It's important to see a doctor in general for wellness. It's not just treating acute diseases, but prevention. So talking about healthy diet, healthy exercise, safety issues, wearing sunscreen, preventing drowning. And then of course vaccination is so important, especially with all of the outbreaks that we're having these days. And talking to your pediatrician if you do have concerns. What does the data show? What's safe? What do you recommend? And if you're seeing the same person all the time, you have a relationship. It's someone you can trust because you've seen them time after time. They've taken good care of your child. They've healed your child time after time. So I think having that relationship is so crucial for prevention as well as treatment.